So today I will be talking about when you need to reconstitute drugs and assessment of sleep and rest. So when it comes to patterns, you are going to want to look for like insomnia, nightmares, poor sleep quality, any type of breathing problems if they're like moving through the night. And the most important thing you're going to want to know is how long is this going on. And then you're going to want to look at rituals. Is the patient taking an afternoon nap every day? Is the patient, these can be good rituals and bad rituals. Like, are they taking a late nap and that's why they can't sleep? Are they not eating enough and they're just hungry? Are they out of their home routine? So like a few good ones may be like reading books, taking a shower, like certain things they may do at home. You sometimes you're going to want to measure like their BP. You're going to want to measure their breathing, just to check their breathing. So like non-invasive measures, they usually don't have to like they won't like enter the body. Sometimes with a CPAP machine that will go up your nose, depending on the type of machine. That's something that is used for sleep apnea, to help with breathing, because they stop breathing in their sleep. So there's also, so like like non-invasive may be like more natural measures that you take, like reading, like showing them to read a book. More invasive measures may be like a sleep study. I've heard horror stories about sleep studies. I've never actually had one, but I haven't really heard good things. I think that also some people may need surgery, if if they have like certain conditions. Also, I know a CPAP machine could possibly, I think could possibly be considered invasive too, because that can be quite uncomfortable. Now sometimes hypnotics are given, which actually they're going to induce sleep, like they're going to hypnotize you. And then there's also sedatives, which they are more just supposed to calm you. They're not supposed to induce sleep. I know we learned about sedatives when we practice restraints, that sometimes a doctor may order a sedative just to calm a patient down. So when it comes to when you're when you need to reconstitute drugs, you are definitely going to want to perform your hand hygiene. You're going to want to, of course, do your 2 checks before you are at the bedside, and your 3rd check when you're at the bedside. You're going to remove the cap and you're going to want to scrub it. Now you're going to want to do the appropriate amount of diluent. So this bottle pretty much explains everything on here. So the strength of the prepared solution, if it's 300 milligrams per ml, then the amount of diluent added will be 9.6 ml, and the volume of the reconstituted solution will be 10 ml. So this very clearly tells you what you need to add, and yeah, so it tells you what you need to add, and this whole thing is yellow. It's 10 ml. So you're definitely going to want to check the bottle. You first want to draw up the correct amount of the diluent, and then you're going to want to inject that into this powdered medication. So then once you remove the needle, you're going to put your cap back on, and you want to kind of like the insulin, this cap isn't going back on too well, but you would want to put the cap back on, and then you're just going to want to gently agitate. You do not ever want to shake, just like the insulin. And then you are going to draw up the prescribed amount of the medication, holding the syringe vertically at eye level. So then once you have that correct dose, you will remove the vial, and you will want to put your safety on your needle. And then you are going to just want to check that again and discard if you have any extra. And then usually the 3rd check is going to be at the bedside. and then you will want to, of course, lock the drawer before administering. Thank you.